Hafaday, good afternoon. Can I get everyone's attention, please? Again, good afternoon, and Hafaday, welcome to the Guam Legislature. I want to welcome a great bunch of individuals from the NCD Consortium. Thank you very much for being here this afternoon. I want to recognize Vice Speaker. Thank you very much, Vice Speaker, for joining me. Senator Frank Uggan, thank you. We do have a very light lunch that we have out in the back. It was being covered by the nice signs out there. But please feel free we have soup, we have sandwiches, we have yogurt, low-fat yogurt, and of course coffee and water. So please feel free to just, take your soup and sandwich and come back in here. We've called this roundtable to really get the whole group in here to be able to provide the Guam Legislature and the public, as this is being televised on the legislative channel, the opportunity to hear from what I call my inspiration. And you know that I've always said that when I come to your NCD meetings, because I know that the healthcare problems that are facing our island, our community, there's really, we can have all the medicines, all the great doctors, but there's one thing that we can really do to combat what's happening is prevention. And so you've developed a strategic plan on how to deal with a lot of these non-communicable diseases. And so a lot of things have already been enacted into law. A lot of things you're doing without the need for any law. But we want to be able to just hear from you again. Now we have all the different groups, that are here that will be presenting to us what the plans are moving forward. And so we scheduled this for about an hour and a half. We'll try to get over everything that we could within that timeline. And so now I'd like to call on Mr. Jim Gillen, Director of Public Health, to be able to just maybe have some opening remarks, and then we'll turn it over to Rosie just to explain a little bit about the NCD Consortium.
Thank you, Senator. I'm just trying to see what I got in my stash here. But I do have the new strategic plan, which I'm glad we have more copies of, because this really is a landmark. I mean, we're getting a lot of good compliments, very positive compliments on this. I'm going to bring this. I'm leaving for Fiji on Sunday. To the heads of health planning meeting. I'm going to bring this, and hopefully she can give me an electronic one also, because this is a model for them to follow in the South Pacific. They're very happy to see the work that we're able to do, and they want to borrow from us, which is good. So we're showing some leadership in the North Pacific. One of the things about the success of this program is not only just Rose and her staff with their 100,000% commitment and their hard work, is that this consortium really, really works. It's really dedicated. They spend a lot of time. They're knowledgeable. They have the numbers. They know what's going on. The projects that they promote are very worthwhile. There's no question that non-communicable diseases, many of them are preventable. It's just like on the other side of the house with our vaccine preventable diseases. If we just get people to buy into immunization, we can alleviate a lot of sickness and a lot of suffering. And if we can get people, the thing with non-communicable diseases, of course, it's a lifestyle kind of a thing, and it's an environmental kind of a thing, and it has more to do with those things, especially our built environment here, and the changes in our diet, and the changes in our lifestyles, and the stresses and the pressures. We have to have, and I've said, it's like I might as well just turn on the record and just let it run every time, because I say the same thing. We need to make fundamental changes in our policies about how we're going to develop this island. We can no longer continue to build housing developments without green space, without places to walk and exercise. We cannot allow the proliferation of stray dogs, because you can't even walk in your own neighborhood because you're concerned about things like that. Now, this is not easy, because we're going to step on a lot of toes, and we're going to make some people upset, because we really need to go and look at some of the developments that are being built, and some that already have been built. There's no place to go to exercise. So we need to do things like that. We need to start. Give up on me. My habits are already set. I'm not going to change very much. But I think our children are the answer. We've got to get them in early. We know that in the learning environment. The earlier you get to them and get to their development, the better the outcomes are going to be. Okay, that's why now we even focus in our child development programs from 0 to 8 years old. Our interventions are there that early. And we have to do that here. It's not easy, and I know how hard you work, and you keep at it, and I really appreciate it, because this really is a lot of work, and it takes away from your time. There's some great projects I know that are being planned, especially hopefully we can roll out that van with the clinic equipment in it, so that we can start visiting the most vulnerable of our population, generally, which is our homeless population, okay, and the problems that they have and have to deal with. We know where they are. We know where they congregate. If we can roll out a van to them and get them into the system, our transportation, our public transportation. You know, a lot of you guys know me. I'm in the office by at least 6 o'clock in the morning. Okay. Now when I roll into that parking lot on Mondays and Wednesdays, which are immunization days, there are people already there at 6 in the morning, and the reason they're there is because they either don't know how the public transportation works, or they can't get it. And they wait an hour and a half for the door to open. Now, if it's bad weather, I let them in, but otherwise, we can't. So, we really need to talk about those kind of things, where people can get to their care, get into the system, in a timely manner. And I know that Rose and her group has some money, thanks to the efforts of Senator Rodriguez, to start actually intervening with our Medicaid folks to get them to buy into primary care. Because a lot of the care they're getting is episodic. Okay, they come in only when they're sick, not feeling well. If we can get them to come into routine care, physical exams, immunizations, all of that, their outcomes are a lot better. Okay, so we just have to keep at it, and I know as long as Rose is there, she's going to pound it, because she keeps bugging me every day. But no, it's worth it. We just have to do it. And I appreciate you, Senator, calling this. You're going to hear some great stories, I think, and exciting kinds of things. But I ask you all again, as policymakers, okay, you get the laws, they get passed, we'll follow the laws. We really do have to make some really hard decisions about how we're going to develop our island from this point forward. Thank you.
Thank you very much, Jim, for that. And now my chief inspirator, Ms. Rolly Zabala, if you can also just introduce all the members who are up here and who will be doing the presentations this morning. Okay.
Good morning, have a day.
Can we, and then also, if you can just speak in the mic, because we are recording this, and then we want to, and this be available
Thank
in the
you.
future.
Director Gillian, that was very nice to hear you say that about me. Okay, thank you, sir. But thank you, sir. The people here, those wearing purple and those who did not wear purple, are all members of the NCD Consortium. These are the leaders in our community, and I'm very happy to see them today. And we have students from the University of Guam, which we hope to get the youths involved, because caring for our community is everybody's concern. And we are really happy that you allow us to meet with you. We're hoping to see also the new senators here, because we want to educate them as to what's going on. But it's okay, we have our champions. We have our champions. And we rely on you, sir and ma'am, to help us introduce legislations, policies, because only with environmental, social policy change we can have greater impact in our community. The work that we do now, we won't see the results in the next few years. It will probably take down the road to see that. But with legislation, policy changes, we can make Guam a better community. And with us here are the leaders of the NCD Consortium. I would rather have them introduce themselves, introduce your team, and we are going to show later on the priorities for each action team. So please bear with us. We will be showing you a video. Okay, we were fortunate to have funding last year from Office of Minority Health Resource Center, and we're hoping to air that in all the theaters, movie theaters, and TVs to educate our community. So go ahead, Miss Alcohol. You want to introduce yourself? Okay.
Prevention, alcohol prevention. My name is Audrey Tapasnia, and I'm the team leader for the Alcohol Prevention and Control Group.
Half a day, I'm Melissa Ontenko, and I represent the Data and Surveillance Action Team.
Yeah, I'm glad I wasn't called Mr. Breastfeeding, but I'm Charlie Morris. I am the action team leader for nutrition.
I'm Bob Barber, and I'm the co-vice chair of the physical activity group.
Good morning. My name is Ben Emanuel. I'm representing the Comprehensive Prenatal Services Program under the Guam Getting Healthy Initiative program.
Today, I'm Chuck Tanner. I'm the chair for the Policy and Advocacy Committee, which is a support group for our action teams, affectionately known as the PANDA. We have an icon.
Good morning. I'm Patrick Lucis. I am the coordinator for the Diabetes Prevention and Control Program, and I'm also the team lead for the Worksite Wellness Program. Good morning.
Good morning. Good afternoon, everybody. My name is Lawrence Alam. I'm the Comprehensive Cancer Control Coordinator and also the coordinator for the Physical Activity Group.
Good afternoon. I'm Marie Benito, and I am the chairperson of the Physical Activity Team.
Half a day, I'm Renata Berdalio, and I'm the current chair of the Guam Comprehensive Cancer Control Coalition, and I work at the Guam Cancer Registry at University of Guam.
Hi, good afternoon. I'm Jared Ivey. I'm the vice chair of the Cancer Coalition.
I'm Ken Leon Guerrero. I'm also on the PANDA team, but I'm also on the Diabetes Action Team.
And just before that, I go on, I want to also recognize Speaker Wanpat for joining us. Thank you very much, Speaker. And also, we do have, again, I want to just remind you, we have soups and sandwiches and salad, so please feel free. I know we're having it during lunch, your lunch hour, so we want to make sure we provide a little something. Thank you.
The agenda today, we will show you the video which will tell you the history of the NCD Consortium.
to address NCDs. The Pacific Island Health Officers Association has declared Guam and the Pacific jurisdiction as an NCD emergency. All cases of chronic diseases keeps rising, and we cannot just let it happen. We have to start now, otherwise we'll find a community, a very unhealthy community.
My name is Chuck Tanner. I'm the chair for the Policy and Advocacy Committee. We affectionately call ourselves the PANDA, Policy and Advocacy, because we can advocate for policy. In other words, I can talk to senators, I can push for legislation, and I think that's important. So our goal is really to look at the strategic plan that we've come up with in NCD, that the action teams, and then we are really a support on to help those action teams pass, or advocacy, just being a voice for good things.
My name is Audrey Tapasnia, and I am the team leader for the Alcohol Prevention and Control Group. Our ultimate goal for the alcohol team is to basically reduce alcohol use and abuse, to include underage drinking amongst our youth and adults. Part of our One Nation campaign is we have families that pledge to be alcohol-free at a Guam Liberation Day. And so every year we have more families pledge to be alcohol-free. And every year we just see the numbers increase. So that's a huge accomplishment for us.
My name is Peter Cruz. I'm with the Tobacco Action Team. With the tobacco team, it's basically decreasing the use of tobacco in Guam. basically lead the way as far as the laws and hopefully the pricing of tobacco products here on Guam. So we work closely with senators and we meet with them and we give them our suggestions of what can possibly be done as far as education of the youth. We've really, in past years, we've really hit the elementary, high schools as far as making sure that they understand the public law, the usage of tobacco within school premises. We have several avenues now in which people who want to quit can take.
My name is Brad Hewitt. I am a member of the Physical Activities Group. Our Physical Activities Group has 4 objectives. My group is particularly involved with is reducing childhood obesity rate, especially in elementary school, and getting after-school programs at the elementary school levels and ensuring that children are receiving their physical activity for the recommended 60 minutes per day as per the CDC guidelines.
I'm Charlie Morris. I am on the NCD Consortium Nutrition Action Team. The team is now split into the breastfeeding group, the salt reduction group, and the fruits and vegetables gardening group. Concentrated mainly with the breastfeeding group. It was breastfeeding month just recently, and they did various activities to promote that. We have successfully changed some legislation, made it law that mothers are allowed to breastfeed in public. The NCD Consortium covers that whole gamut of individuals who need the assistance and support of a consortium such as this.
All I can say is that addressing the NCDs is not only public health concern. Each and everyone here in Guam has a responsibility to help us really make our community a healthy community. So I appeal to all the people in Guam to take part in these efforts. Okay, you can do it in your own way. Start by being healthy. Extend it to your family. Encourage your family to be healthy, active, eating healthy food, and then it will reach out to the community. If you can show to your community that you are doing this, I'm sure that it will be contagious. People in your community will follow.
Thank you very much for that very moving video that you shared. So we'll go ahead on. Audrey?
Hello. Okay. Okay. You've heard in the video we just watched about the alcohol group, and our goal is to reduce the prevalence of alcohol use and abuse. And I'm aware that everyone does have a copy of our objectives and our strategies, so I'm not really going to go into that because of time. If you could do the next slide. So I wanted to just kind of focus really quick on some of our successes since then. Supporting our One Nation Alcohol-Free campaign. Creating and establishing our responsible service beverage training, implementing the expert. This is where we have our screening tools, and we're looking at screening at clinics. We've already started administering the survey at middle schools and high schools. And in addition to that, I want to also acknowledge and thank past and present senators who assisted our efforts in passing 6 laws, and the laws are listed there: alcohol-free parks, raising the minimum legal drinking age, stiffer penalties, reducing the hours of sales, the Responsible Service Act, and our Social Host Act. But our work must continue. And on behalf of the alcohol group, we are continuing to seek your support in 2 more measures. And one of them is to Public Law 30-65 requires 15% of the alcohol, 15% of our parks to be alcohol-free. we're asking why not be 100%? You know, we have youth, we have families, even other adults. We want them to feel safe when they're going to have plan an event or a family gathering at our parks. Why not? Why not make it 100% alcohol-free? The other thing we wanted to seek your support in is increasing the taxes. There is strong evidence of effectiveness for reducing excessive alcohol consumption and other related harms, such as underage drinking, motor vehicle crashes and fatalities, and there's so much more. There is that strong evidence that raising the taxes does help reduce all these things. And I wanted to just point out that the last tax increase was actually in 2003, were the last increase. So this, we are seeking your support to help us continue to reduce the prevalence of alcohol use and abuse. And to end my presentation, we wanted to show our TV PSA. This is one of our new campaigns, the social host awareness campaigns. We wanted to educate the community about this law, how it holds adults accountable for serving or providing alcohol to minors at their event. We're looking at airing this PSA during the month of April, because April is Alcohol Awareness Month. Thank you for your continued support.
At bars, and especially around family.
Hey, Uncle, can I have a beer? Yeah, let me get you one.
Underage drinking should never be tolerated.
All right.
Put it down and come here.
Second thought.
Responsible behavior begins at home.
Uncle, I thought you were cool.
At family parties, it's our responsibility as hosts to make sure that our underage guests do not have access to alcohol. But the Guam Social Host Act is more than just a law that we have to follow. It is an opportunity for us, adults, to talk to our kids about the harmful effects of alcohol. It is a reminder that parents and elders should be modeling positive lifestyle choices for the younger generation. So do the right thing, stay sober, and in control.
Would you like me to turn this one off as well? Okay. Thank you, Senators, for allowing us to come here and speak with you. My name is Chris Serla. I'm representing the Tobacco Prevention and Control Action Team. And as you look at the slides, it shows us what we will be working on for the next 4 years. Tobacco use, as you know it, still remains the #1 preventable risk factor for deaths and diseases within the nation, probably most likely within the island. In 2013, the BRFSS reported out that on Guam, our adult smoking rate is at 26.5%. And when we compare that with the states within the nation, we come up tied for second. So Kentucky is first, and then West Virginia, and then I believe, sorry, I have this over here. Oh, Arkansas is third. So what we hope to achieve with the NCD Consortium is a reduction of tobacco use within our island. We're shooting for 18%, tobacco use to be at 18% for both adults and children by the year 2018. That number would keep us below the national average of 19%. And the way that we're planning on doing this is with your help. We have outlined 3 objectives. The first one is a 100% tax increase on all tobacco products. The second objective is to revisit our Natasha Protection Act. There are some exceptions that we want to look over, and hopefully we can close these exceptions. These exceptions are you're allowed to smoke in patios, outdoor patios, or any place with an overhang. And the problem with that is if people are walking, if the public is walking towards an entrance or walking through those outdoor patios, they are exposed to secondhand smoke. And finally, the third objective that we're working on is to eliminate or include brief tobacco intervention, skill certification, and other cessation resources in our Government of Guam Worksite Wellness Program. And the reason why we chose these as our objectives, when we looked at the recommendations by the World Health Organization and to some degree the Centers for Disease Control, they do push these as effective evidence-based interventions for lowering tobacco rates. If you look at World Health Organization, under their Empower model, the R in Empower stands for raising taxes, and then the P in Empower stands for protecting the public from secondhand smoke. And then when you, and what we're trying to do is build the capacity of our cessation resources, build the reach of our cessation resources so that it reaches all people who are ready and willing to quit tobacco use. And I guess the number one question is, well, will these strategies work on Guam? And the truth is, the answer is yes. They have been working. If you take a look at this graph that we have on screen, the blue line represents Guam high school students over a period from 1995 to 2011, and then you'll see a downward trend. But what we've noted at the very top with the arrows pointing downwards is that at every significant policy change or tax increase, there was a significant drop in high school tobacco use. And to conclude this, in respect of everybody's time, we do have other emerging issues that we are keeping on our radar, and these are a few of them. The first thing that we're looking at is whether or not we should raise the tobacco purchasing age from 18 to 21. We're looking to fund or expand funding to our tobacco-free Guam quit line. We want, and the last two are kind of together, electronic cigarettes and expanding the tobacco control policies to these nicotine delivery devices, excluding FDA regulations. Thank you very much. I think I went over my 2-minute time.
Thank you, Senators, for this time to come and present on our Nutrition Action Team goals and objectives. Just in general, one of the things that sort of are characterized in all three objectives is to collect baseline data for long-term sustainability, to find those areas where we can actually identify what we can use to sort of monitor our progress as we go along. Our first focus area was community gardens. We want, the Guam diet has so much of a lack of fruits and vegetables in the diet, meat and rice. We want to make it a culturally appropriate thing for vegetables to be in the diet. One of the problems is the high expense of fruits and vegetables. And so the Community Garden Project seeks to go out and talk to faith-based organizations, communities, schools, try and get them to develop gardens and vegetables and disseminate to the public and the people that they contact so that fruits and vegetables will be integrated into the Guam diet. And there's also, the project also provides some technical assistance as well as seed money incentives to start new gardens. The second focus area is salt reduction because of the high rate of heart disease and stroke on Guam. To reduce salt intake is a major and cost-effective intervention that can decrease the incidence of hypertension and its related chronic diseases that can result from high salt intake. The approach is to educate the public on high salt diets and to establish local public-private partnerships. What we try and do is reduce adding salt at the table, taking salt away from institutional type of places like schools and the prisons. If you remove the salt shakers, you decrease salt intake, and also to explore alternative seasoning methods that don't involve sodium and salt. And so that's the approach that we've taken on salt reduction. And finally, the Director Gillen was talking about the earliest intervention. Breastfeeding is the absolute earliest intervention because it starts right out of the womb. What we emphasize in breastfeeding is skin-to-skin contact with the mother immediately after birth, because that is the time when the mom is, or the baby is most alert and responsive to initiate these good practices. And so we've hit breastfeeding from several angles to increase the incidence and duration. We want to establish Guam Memorial Hospital as a baby-friendly hospital, and quite honestly, that has been the biggest challenge that we've had. Baby-friendly hospital initiative has been around for 2 decades, and we have worked not too successfully to establish those kind of policies that enable breastfeeding on demand and the elimination of breastfeeding supplements from the hospital. And so we really need to work on that. We've developed environmental interventions, most notably some of the legislation that passed, Public Law 32-298, which the legislature is responsible for. I don't think we had one dissenting vote when that went to the legislature. So, we are so appreciative of this beginning of that women can bring their babies into and breastfeed in public, and they are absolutely protected, as stated in the law, from doing that whenever the baby needs to be fed. And we want to develop breastfeeding resources for health professionals and just a support infrastructure in Guam, which would include the establishment of a breast milk bank rather than just to supplement with formula automatically. So these are the things, and we have a very dedicated group of people in this group, and we are hopefully in progress, and we'll be seeking support of the legislature as we go along. Thank you.
Today we need to talk about salt recommendations. Our daily salt recommendation is less than 5 grams a day, which equates to less than 2,000 milligrams of sodium a day.
Taste your food before adding salt or soy sauce. Reduce your salt by reading labels and looking for lower sodium products. Do not add salt at the table. Look for low salt recipes, limit salt in cooking, and always measure the amount needed. Use fresh herbs instead of salt. Abandon old habits to live a healthier and longer life.
How are you? I'm good. How are you? Good. Oh, you look great. Thank you. Are you breastfeeding? I am. Are you thinking about breastfeeding this one? I'm not sure. Do you think I should? Oh, definitely. The doctor said it was a really great option.
But breastfeeding is healthy for you too. Breastfeeding helps shrink the uterus to pre-pregnancy size. You have bonding time, and you can still do whatever you want.
You know, she hardly ever gets sick, and we have a lot of bonding time, and I still get to do everything I want to do, so it's really great.
She's healthy.
Yeah, she's awesome.
A variety of products to help you breastfeed your baby are available locally. Public Law 32-098, the Nana Putgan Act. A woman may breastfeed a baby in any location, public or private, where the woman is otherwise authorized to be. Breastfeeding on Guam is becoming the norm thanks to mothers like you who choose to feed their babies anytime, anywhere. Your children are worth it. Breastfed babies are healthy and happy.
Thank you for having us here. So I'm the other part of obesity prevention. So you know that I won't have to repeat it. Obesity is a big problem in our island, both in adults and in the youth. And to be able to tackle obesity, you need to tackle nutrition and physical activity. And so that's my team right now. And so I'm just gonna say a little bit about our team. Our team has 4 big objectives in the NCD plan, the purple book that you have right now. And basically what it is it's just saying we want to target the adults, and the way we're going to target it is increase the amount of minutes that the adults do in a week. It's 150 minutes of physical activity a week recommended by the U.S. Physical Activity Guidelines for Americans. And for children, it's 60 minutes a day for elementary school, middle school, and high school. And so we've planned for activities and programs that address these objectives. So let me go on to the adult side. So we actually try to focus more on environmental change. At least for this first year, we partnered with Island Girl Power to do the Kaiser Parks project, and that has been a very successful project. They did a park cleanup, followed by implementing programs inside the parks. We also work with iBike and the Guam Cycling Federation. If you've seen the Sharrows along Tumon, right? That's the work that the iBike and the Cycling Federation did. And that's really to promote bicycle use in our community, which is, our community is really perfect for these kinds of activities. We're not too cold, we're not super hot, we're just perfect. And also we supported installing exercise machines in both Northern and Paseo. So if you've seen those 5-course exercise stations, it's just a way to bring back those stations. Because right now, if you look at kids, they don't know how to use those exercise equipment. Why? Because they're sitting down playing their video games, right? That's the exercise they know now, at least for this generation. So we wanted to promote those things. The second and third objective really go hand in hand. It's really targeting the kids, elementary school, middle school, and high school. And we have combinations of strategies in trying to make sure that the children get the proper physical activity that they need a day. And so we've been really working hand in hand with DOE to ensure that the kids get the proper amount of physical activities. And so the first part of the year, where we were looking at current policies that they have in terms of what the children need. We also introduced some sustainable after-school program. The BASIS after-school program and the CrossFit after-school programs are both sustainable activities that we brought in. And of course, we'd like to thank the Senator for giving us some funding, and we've been working really, really hard. Took us almost 9 months to plan this out, and I'll let Bob later on to explain what we've come up, but some kind of a plan to ensure that physical activity is met in the schools. But what we do find is that at the end of the day, the schools really need PE teachers to be back in schools. And so our team has been discussing some kind of a mechanism to ensure that, how are we going to ensure that PE teachers are there? Because you have to understand that, the performance of children, they improve their school performance if they get some kind of physical activity, if they're more active in school and stuff like that. And we were talking about maybe some kind of sugar bevy sugar levy tax or some sugar beverage tax that could fund these PE teachers back, because we understand, there's monies are hard and stuff like that. And lastly, of course, objective number 4 is to increase physical activities with our government employees. We spend 8 hours of our day in work, and it is really important to get our employees going. And it's really been a successful year for the Worksite Wellness Program. In 2013, we had 200 employees on the program. Now we got more than 1,000. And Patrick really has been really good in coordinating the program, as well as Chuck and the rest of the team. And because of the improvements in the program components, like for example, if you see there, we have the Worksite Wellness Rewards system. And so we've been working with private organizations and all those things to come up with incentives for employees to do these programs. We also did the health coach training, so the health coaches know how to do these biometric measures. We've done the employee health screening, so it's not just going to the gym. You actually understand why you're going to the gym, whether it's high blood pressure or blood sugar, cholesterol, and all those things. And so our team has been really, really blessed this year. We've gotten several awards from the Governor's Council on Physical Fitness and Sport, Kaiser Park's BASIS program, the Worksite Wellness Program. MagPro also recognized the Worksite Wellness Program as an outstanding program. And of course, Patrick Lucis was recognized in KUM Care Force for health and wellness. Thank you.
Today, I'm Chuck, Panda Guy. We're going to do a video? You got a video? I don't have a video. Again, I don't have a video, but I used to do this gig on K57 with Renee back here, and we got fired, but that's okay. They had a saying, the views, don't necessarily reflect. Well, the views of the NCD Consortium do not necessarily reflect the opinions of the Department of Public Health. This is not the Department of Public Health. This is a community-based organization, and that is where the strength comes. I've been in healthcare 20 years plus. I have never in my life seen government, not-for-profits, private, the insurance, all sitting at a table. Oh my God, what a gem. I've lived long enough to see that. So that is the beauty of what the NCD is. And what does PANDA do? So PANDA supports, I bugged the guys across there, emails and different things, and the team behind me. I know how hard it is to get 15 senators to agree. We have 50 different organizations and 200 people. So a lot of what PANDA does is try to come up with consensus, and a lot of how we do that is sitting in front of you. Strategic plan, that's our core. So PANDA follows the core, and then we also support these people over here with comprehensive cancer. They have different shirts. So that's our core, but we also in PANDA take a health in all policies. It's an actual program, health in all policies. So a lot of what we do is I'm a frequent visitor on your calendar and your bills, and that was kind of what we did last year. What I'd like to do, and the reason why we're kind of here today, is get a little bit more proactive and get with the senators prior to that. Because when I see a bill, I got 500 people on my email, and I fly this out there. It's a little bit retrospective. So what PANDA has tried to do, and you'll see our slide, is to get to know the senators, and if they have an idea, maybe try to get in front of it a little bit so we can put in our 2 cents for being blatant, and we can do that because we are a community-based organization. Public health is a government organization. I am free. I don't work for public health. I work for the doctor's clinic, and I also have not-for-profit. So the freedom of PANDA is the ability to kind of disagree sometimes, or agree, or support, or do whatever we do. So that's really kind of what we do in PANDA. Again, evidence-based, try to get ahead of it. After this, and in closing, after this, it's our plan to get on the phone, call every senator, set up a time so we can go in all these little objectives, kind of get with y'all and kind of work with you and flesh it out. So thank you very much. Sorry, no video.
Howdy, I'm Melissa, and the Data and Surveillance Action Team was primary. Hello? Howdy. My name's Alyssa, and I represent the data team. The Data and Surveillance Action Team was primarily created to support all the other action teams in collecting and sharing the data that can be used to measure the progress of our efforts in preventing NCDs. And we have 2 main objectives. They are to establish an infrastructure of the health indicators that the action teams are focusing on, and to have a centralized data and surveillance system of these indicators. And our priorities are to disseminate the data and surveillance highlights report, which was completed by the data team last month and presented to the NCD Consortium. And basically the DASH report was developed to benchmark the consortium's progress towards reducing these indicators. And we plan to disseminate the electronic and printed copies to all the NCD members and the 50 agencies of which they represent. And a copy is available for you in your packet. And we will continue to update the DASH annually. Our other priorities are to work with the other action teams who need to revise their objectives so that it can be measurable and can provide a clear baseline. And then our third priority is to temporarily house the NCD data under the Bureau of Statistics and Plans website until such time the enhancements of the Live Healthy Guam website is completed. Thank you.
Okay, thank you. So talking about the Diabetes Coalition, it has been founded in 2008, and we're made up of with government, private, faith-based private organizations. We're happy, just like Chuck mentioned earlier, we have all our four major insurance on board as well. The vision of the Diabetes Coalition is for people to be in a diabetes-free community, living in with healthy lifestyles and a healthy environment. And our mission is for the Diabetes Coalition to reduce the incidence and mortality of diabetes. I wanted to just show you this one little corner of this slide over here. What we see there, the one that's highlighted, diabetes affects those that are less than high school education. Next slide, please. I wanted to point out on the next chart over there, it's hitting those that are within the income range of 15 to 25,000. So the Guam Diabetes Control Coalition set 3 objectives for itself, and number 1 is to get about 75% of health clinics to adopt the American Diabetes Association standards of care. Number 2 is to provide a trainer-to-trainer training for our clinicians, and by 2018 we hope to provide diabetes education to 75% of those newly diagnosed with diabetes. Next slide, please. This slide here wanted to point out the relation of the obesity and diabetes. CDC says that, or actually, if you look at the left side of the screen here, we have the weight of our middle school kids from 6 to 8. We see that it's from 24% to almost 30% overweight, and then when we look at our high school kids, we're looking at 30% to almost 40%. And when we look at our adult overweight and obese weight in the last 10 years, we're seeing this upward trend up to over 62%. So kind of tells the picture of why we're here where we're at with our overweight and obese for our adults. CDC says you're not supposed to get diabetes until the age of 40, and we're now seeing it in our 20s and our 18s, and the youngest diagnosed with type 2 diabetes here in Guam is 5 years old. Our one of the ophthalmologist's office here has the youngest person with blindness because of diabetes is at 16 years old, and they're seeing people in their 20s. In the dialysis centers, we're also seeing people in their 20s as well. The youngest that we know that had a heart attack was at 24 years old. Wanted to point out to this other CDC data here. In 1974, the obese rate for kids was at 5%. In 2008, it is at 17%. Here in Guam, the combination of our school kids, overweight and obese, is at 40%. So it shows we have to do a lot of work. Next slide. So I know we talked about a lot of the risk factors of alcohol, tobacco, nutrition, physical activity, and we don't address those. They may come over here to the diabetes side, and this is where we try to make sure that you are in compliance with your diabetes. And so with this coalition is made up of all these stakeholders. We're very happy to see a lot of them jump on board, and we have about 4 major events throughout the year, and that's what you have listed up there. The group also looks at doing diabetes asset mapping, and also does some surveys to find those gap data that we're missing here on the island. One of the other things that we always try to stress is to address NCDs where we live, where we learn, where we work, where we play, and where we practice our faith, and that's what we've been talking about here. When we were working on some of these policies, or looking at doing a scan on some of the NCD policies back in between 2008 and 2010, we found very few. It was actually, we found only a few that we could actually count on the hands. I really want to applaud our policy makers now, because we're seeing a lot of NCD policies coming out, and this is something that we need to see more of, like what we have stressed here. One of the other policies that we are addressing is the healthy vending machine policy, which allows 50% access of healthy items in the government agencies. One of the challenges that we're seeing is that the healthy items cost more than the not so healthy items. So I'm hoping that future policies would address, making the healthier items cheaper, and maybe having the not so healthy items maybe, I don't want to use the word tax, but do have some kind of offset to make the healthier items healthier. So thank you. That's all we have for diabetes. Source of revenue. Okay, not tax.
Okay, half a day. Again, my name is Renata Budali. I'm the current chair of the Guam Cancer Coalition. This is Jared Ivey. He's a co-chair. Again, the coalition is a community-based coalition. We are not public health, but we have excellent support from public health, and I really do want to recognize the public health team, Rose, Long, Vivian, Jen. I would not volunteer to be chairperson if I didn't have that excellent support. But we also have excellent support from the community, American Cancer Society, Guam Cancer Care, just a lot of different community organizations that make up the coalition. Okay. So again, the vision, we really do, we want to imagine Guam families with fewer cases of cancer. Everyone here has either an immediate family member or extended family member that has cancer, I'm pretty sure. And again, we need to look at our environment. So our vision is that people of Guam would be cancer-free, embracing a healthy lifestyle and living in a healthy environment. And with things like the military buildup and just in general progress and buildup on Guam, we need to really look at the environment and make sure that things like our beautiful Guam, we have very little pollution on Guam. We want it to stay that way. So we always have to look at these things and keep these things in mind. Again, the mission is to reduce cancer incidence, so reduce the number of cases of cancer, and reduce number of deaths from cancer. Just briefly, right now we're in the second five-year grant from Centers for Disease Control, 2012 to 2013. We received our second 5-year funding, and we're currently implementing our second cancer control plan, which is 2013 to 2017, and I believe you may all have a copy of this. Okay, so again, the heart of our coalition are the action teams, and so we have 5 basic action teams. The prevention action team wants to prevent and reduce exposure to cancer risk factors. There are many of them we've mentioned already. The screening, early detection, and treatment action team wants to detect all cancers at the earliest stage. Again, there's been so much progress in cancer detection and treatment. Many cancers can be detected early, like breast and colorectal cancer and prostate cancer, and those are some of the most common cancers. Lung cancer is more difficult to detect, but the ones that are more easily detectable, we really want to encourage people to get tested. Survivorship and Quality of Life Action Team, right now they're working on a video of cancer survivors from Guam sharing their experience, strength, and hope, and that should be coming out soon. Later on, we'll talk about some of our products and accomplishments. But again, the goal here is to enhance the quality of life for cancer survivors. And believe me, there are many, many cancer survivors on Guam. Cancer is not a death sentence. And there are many people, and especially with childhood cancer, some of the greatest progress in cancer treatment has been with childhood cancer. Yet these children that are survivors of cancer are looking at a lifetime ahead of them with the effects of cancer treatment. Sometimes cancer treatment causes other cancers, like from radiation treatment. So again, we're looking at quality of life and how to enhance that and keep access to treatment. Okay, the data and research team. I also work at Guam Cancer Registry. That's our main source of cancer data. So we want to always improve the collection and the quality of data that we get. Thank you, senators, for passing the law that made cancer a reportable disease in 1998, and also with your help, now Guam Cancer Registry is funded locally through the cancer tax, and thank goodness, because prior to that we were fully funded through a federal grant, which right now we don't have. So if right now we don't have that U54 grant, we're reapplying for it. The University of Guam is, and if we didn't have the support from the from the Healthy Futures Fund, there wouldn't be a registry. So we thank you for the support, and please keep it going. Again, there's a Policy and Advocacy Action Team, PANDA. So again, the coalition, we work hand in hand with the NCD Consortium, and even some of our action groups have some of the same members, and so we integrate wherever we can. Jared's going to talk about some of our accomplishments.
Like that we've made.
2008 and 2012, thank you, actually provides the community, providers and policymakers with the data that you need to make the important decisions that you are making and that we know that you'll continue to make. In regards to survivorship and quality of life of cancer patients and their families across the continuum of cancer. This is, from a palliative care perspective, those pre-cancer diagnosis, those at cancer diagnosis, all the way to those post-cancer treatment. The survivors, and then also including the survivors, the caregivers, the families, the loved ones. All right. So in my day job, I manage a hospice team for Health Services of the Pacific. I was just looking at numbers this morning. In last year, we had 67 deaths through our hospice that were directly related to cancer on Guam. For a small community like ours, and for one hospice agency out of 2 on the island, we think that's too many. And so the focus on survivorship care and education is a very real priority for those who are involved in the coalition. And I think that there are actually many, many people. Those in the coalition, will you stand up if you're in this room? Come on, stand up, stand up, stand up. So even if you're part, yeah, there you go. So a lot of the purple shirts and the black shirts and the regular shirts, even in our most recent retreat in December, we had 25 new community members that joined the coalition. So this is an ongoing process. And we consider that to be one of our greatest accomplishments. The other is in the development of our workforce, the training of evidence-based effective strategies and skills for our providers. We do that through the promotion of the 2013 and 14 U.S. Preventative Services Task Force guidelines to healthcare professionals. And then you also see up there the Breast Cancer Awareness Month. We know that everyone in this room has seen or participated in those many activities for the last 3 years, going on 4 years. And I think that the beauty of that is that we know from the data that there is a direct positive correlation in drops of mortality rates to cancer associated with an increase in prevention activities and evidence-based screening activities. And so that Breast Cancer Awareness Month is actually one of the direct results of that. So you, as the policymakers of our beautiful island, know the different policy changes that you've supported, and we celebrate those things. They're bulleted up there for you, but I know that you know them. Amongst them, highlighted is the tobacco tax increase and the tobacco tax parity funded cancer registry and trust fund that Renata is a part of and has mentioned. The elimination of multi-pack discount schemes, which was a huge accomplishment and success. And we thank our policy and advocacy team for their hard work on that, and senators for your positive votes in that regard. And of course, the prohibiting the sale and distribution of electronic cigarettes to minors. We know that although it reduces the risk, some of the risks associated with secondhand smoke, electronic cigarettes still come with risks, right? And we don't want our minors participating in that. And then, of course, expanding authorized programs to the Guam Cancer Trust Fund to include allowing cancer education and outreach, which we feel are all very important. And these are just a few of the highlighted accomplishments in the last 8 years of the coalition, and we're sure that we will have many more.
Okay, next slide. Again, with the recognitions, we have been recognized locally and also nationally. And I would just like anyone here in the audience who has been recognized for one of these awards, could you please stand up? Renee, I know you're one of them. Even Senator Rodriguez.
Renee, Senator Rodriguez.
Again, so there's Sea Change Awards, it's a regional award, the Appeal Award, Governor's Council on Physical Fitness and Sports, Governor's MAGPRO Award, which was mentioned before, and CDC Division of Cancer Prevention and Control. There was the Best Poster Award. And these recognitions are important because, again, they encourage, the hard work of Most of the people in the coalition are volunteers, although many of us, our jobs are closely related also to cancer work. So I just want to finish off with policy work. So again, where do we get the biggest bang for our buck? With policy change. I mean, how do we affect the most change is through policy. Again, so what we're asking for and what we're working on now, the different teams, the prevention team, we just want the 50% of our parks, of our neighborhood parks, to be available for use. I mean, that's not asking a lot. So why aren't our parks available for use? Many of them are run down. Gov Guam doesn't have the money for upkeep. You know, mayors don't have enough money for upkeep. I know let's see, tennis. There's a tennis. What do you call it? A tennis court in Sinahanya, hidden. I don't even know exactly where it is. It's in the central part of the village. And again, if that tennis court was cleaned up, and we've got the perfect environment, and this is what we're trying to do, right? Fight obesity. I mean, me myself, with my sit-down registry work, I've gained quite a lot of weight in the last 10 years. If anybody that knows me is here, and again, cancer is associated with age, unfortunately, and age is associated with a bigger gut. Okay, so we want access to at least 50% of our neighborhood and school playgrounds. Screening and early detection, we want at least 60% of health providers on Guam to follow evidence-based procedures when it comes to prevention and screening guidelines. With our survivorship and quality of life action team, again, we want nurses and doctors to be schooled and to have to earn credits in the area of palliative care. And again, that's care for terminally ill patients. It's not curative care, but it's comfort care, and it's a very important part of quality of life. For our data and research action team, we have the laws in place, but we need better enforcement, better data sharing with our local health providers and insurance companies. And I can tell you that when we get this data, a while back we got a lot of data from MIP and Medicaid, and it's extremely valuable, extremely valuable. It allows us to really capture the data that we need for our abstracts. And that's it for the Guam Cancer Coalition. Senators, just thank you for your support of our coalition, and look forward to your continued support.
Hafade, thank you everyone. My name is Al Silverio, and I work for the Guam Department of Public Health and Social Services, and I manage what's called the Office of Minority Health. We exist to reduce and eliminate health disparities around Guam. We have a number of different ethnic groups that are disproportionately highly represented in unemployment, in incarcerated communities, those involved in the judiciary, those who cannot read, and those who cannot access services because of our multilingual, multicultural populations here on Guam. What we do is we provide CLAS, C-L-A-S. We are the only provider of culturally and linguistically appropriate services, and we are very proud to report that we have trained over 2,500 government of Guam and private sector people in becoming more culturally and linguistically appropriate here on Guam. We have our biases and perceptions, but we cannot treat people differently based on them. So our trainings help make sure that these folks get the access to language equity that they deserve. In fact, when I first went back to public health for 1 year, and I shared this with Dr. Kaneshiro, thank you, doctor, for championing the culturally linguistically appropriate services, I would say good morning to 2 nurses every single day, and no one would respond. And so one day, both nurses said good morning back to me. I said, what changed? What changed after 1 year and 2 weeks? They said, well, we found out you're Filipino. Right? So if they found out I'm Filipino after 1 year, how are you treating your patients and your clients, right? So it had to change. When I presented that to the dental group, Dr. Kaneshiro was so surprised, and now she had made it mandatory for certain public health employees who are service providers to take the class trainings. We have a backlog. We have a list of people wanting to take this. What we would like to do is to make this mandatory for all government and Guam employees. It's a 7-hour course. The curriculum was localized and developed by Office of Minority Health as well. 1 year ago, we provided the very first language conference here on Guam, CLC, together with the judiciary, with Judge Barrett Anderson. We're very innovative. We provided the first Veterans Health Conference. I know, Senator Uggan, you were there to help inaugurate that. We provided the first Micronesian Behavioral Health Conference. We work with Project Carino, our partners in Ifamagonta and the Guam Behavioral Health and Wellness Center. So all the discussions you heard today, that you heard of, the Office of Minority Health is directly connected to them. Every commercial that you saw is locally produced, local talent, local people here, by people who live and work on Guam. We make sure that we translate our brochures into different languages: Chuukese, Chinese, Mandarin, Cantonese, Chamorro, Tagalog. We have many different resources, and you can get them through us at the Department of Public Health and Social Services. So you see some of the programs that we have: access to language equity, development of a language access plan. This is excellent for Guam because the Office of Minority Health is ensuring that all of you receiving federal dollars are in compliance with the Civil Rights Act of 1964. As close as Hawaii, the judiciary has lost $75 million in 2014 because they did not provide class trainings within their jurisdiction. So we're good. We're preserving that. And we're making sure that the quality of our federal funding is here for you. Okay? Thank you, everyone.
I can hear your stomach growling. I'm hungry, and I know you're hungry, but we still have some few. This is the latest because of the work that we do. The NCD Consortium has been entrusted $1 million by legislature to manage. And what is this? This is to implement the Getting Guam Healthy Incentive Program. Okay, go ahead. And Honorable Speaker, we are in the process of requesting you to appropriate the funds so we can implement this program and activities. So the $700,000, okay, we have reporters on what programs we are going to implement out of this money. And the next slide, please. $300,000 is dedicated to improve the physical activity in schools during and after school hours. So then go ahead. Introduce the prenatal comprehensive services, and then followed by Ken, who will talk about the management of diabetes and then also the DOE projects.
Well, for the comprehensive prenatal service program, the goal of the program is to educate the Medicaid patients about the importance of early prenatal care and also the provision of comprehensive prenatal care in collaboration with our community partners. So, we came up with the objective to increase, the number of the percentage of Medicaid patients who seek prenatal care during the first trimester of pregnancy by 30%. So our priority areas are listed there below. And our second objective, next slide please, decrease the percentage of Medicaid patients with low birth weights. And we will be, establishing our baseline during the first year of implementing this program. And our priority areas are also listed below. And these are our community partners. We are partnering with the Bureau of Primary Care Services to oversee the 2 community health centers. Of course, the Bureau of Community Health Services, who administer the NCD Consortium, will also be working with the Maternal and Child Health Program, the Bureau of Economic Security, who assess Medicaid eligibility, and also the Bureau of Healthcare Financing Administration, who oversee the Medicaid program, and other health providers who will be providing prenatal services to our Medicaid patients. Thank you.
Then another project. Okay.
One minute. Nothing like a lot of pressure. All right. Since I've only got 1 minute, I'll sum it up very quickly. The Diabetes Project is about to kick off. It's going to address 3 threats that face the population of Guam: hypertension, diabetes, and obesity. To give you an idea of the impact this program is going to have on Guam, we go to Seattle, Washington, where a group like the NCD started in Seattle and working very closely on these initiatives targeting obesity, hypertension, and diabetes, and a workforce wellness program like the NCD is pushing now. In 2012, King County, Washington got a $61 million experience refund on their group medical insurance program for government employees. And that represented about a 35% experience refund. Now, when you look at the fact that the King County government is about the same size as government of Guam, and the fact that I am a zealot for this program because I walked up to the edge of diabetes, and as a self-pay, I was personally out of pocket about $8,500 a year. But following the program, next slide, that we are kicking off, next slide, this is the summary of it. This type program, I went through it personally, and I saved $17,000 personally over the past 2 years. I'm the same age and profile as the Medicaid recipients. I had the same medical pathology, so if we look at how many Medicaid participants we're going to be addressing in this program, let's do the math from a legislative and finance point of view. But what I want to do also is the entire NCD program that we've talked to you here about today is a very similar approach what we saw at King County in Washington State. And if King County can get a 35% experience refund on their group medical insurance, what could we do here on Guam? King County, by the way, is 13,000 employees. Government of Guam is a little over 11. So let's do the math. And when we look at the proportion of our population that's on Medicaid, and I fit that profile, although I was self-pay, you know, for me to save $17,000 over 2 years, what would be the impact on the coffers of the government of Guam if we could see a similar result? So that's why this program is kicking off now, and we expect to see the kind of success in it that they saw in King County. But when you add that to the workforce wellness program and every other program that the NCD is pushing right here, we expect to see the same type of results they saw in the same time frame. Thank you.
Okay, so she's got me on a thing, so I'll put it on the timer. Patrick's numbers were really scary, guys. I don't know. To me, it's terrifying to think about how bad this obesity is. I would like to ask, wouldn't we all like to improve the health of our children? You guys have done a major thing in allocating in this bill $300,000 to improve wellness and physical activity in DOE. I'm going to briefly report to you on the plan that we've gotten for this. It has 4 components. The first component is to be able to even know if we're having an impact, we have to be able to monitor. The school nurses have been begging for years for proper equipment, software, and a server to link them all together so that we can standardize and have reliable data we can base it on. So the first objective is in 8 pilot schools, we're going to equip, train, and support the school nurses to be so that they conduct BMI screenings both prior to the implementation and after that. And we're doing it in a way that would be sustainable so that as more funds become available, more schools can be brought in. The second component, and where the most money is going, is we're focusing on elementary here because lifetime patterns are set at the early age. And right now, we do not have PE in the elementary schools. What's more, to my understanding, within DOE administration and the curriculum group, there's just one person tasked with PE, mostly handling intramural sports, overwhelmed, and so there's not a lot of support. Rather than trying to place PE teachers in every school, what we believe would be a far better approach is to get an evidence-based curriculum which can be used in small time blocks, 5 minutes to an hour, for in-school and after-school programs, and motivate, train principals, teachers, and aides in how to use this within the schools. So this is where we're putting $175,000 of this funds into, to get the curriculum, to train them, to equip them, and have a coordinator to help support them in doing this. Also, out there are so many ideas and innovation. You've heard many coming from the NCD, and many NCD partner organizations have stuff. Many of us have come into schools and done programs, but that's the problem. We've come into schools and we have done programs, and then we've gone out. The teachers have not been, it's not been sustainable. The teachers have not been able to replicate it. So what we're setting up is a pool of funds for mini grants for teachers and other organizations to develop curriculum and then implement it and teach the teachers how to continue on with it. And in part of the mini grant would be be whatever is needed to make it sustainable, whether it's equipment, training, or actually printed curriculum. And then finally, as mandated by the bill, we've set aside $20,000 to support the Special Olympics. And now, briefly, since I'm told I'm almost halfway through my time, I want to go into a little bit more about how we hope to implement this curriculum. Our objective is to reach 20 education professionals in each of 8 elementary schools so that we have an impact on 160 education professionals. One of the things we at UOG and GCC have learned in doing teacher trainings is that teachers love to get new material. It's nice to get certificates, it's nice to get CU credits, but what they really need for their careers is graduate credits. So what we've been able to do is we have identified both and independently, UOG, a coalition, and UOG working with Hawaii, Alaska, and the islands have identified an evidence-based program called SPARK. Independently, GCC's elementary ed group also identified SPARK. Independently, DOE administration also identified SPARK as a evidence-based program that is highly flexible, can be used for long periods of time or as short as 5 minutes before class. And so what we have been able to do working with UOG and GCC is we're going to offer them a professional development for physical education 3-credit graduate course for all the teachers and aides that wish graduate credit. The course will be for all 160 that we're trying to impact, but we will give them 3 graduate credits out of this. So this is a powerful, we hope, incentive to get teachers started on it. Then each teacher and staff undergoing the session will receive they'll receive the full 3-year online license to access the SPARK curriculum, which is a massive amount of activities and stuff. They'll be able to download as they want, and we use this as a mining time for the schools to be able to bring as much SPARK in, adapt it, make it, localize it for Guam, and have it in curriculum that DOE can later use. But in addition to this, they want something from our pilot programs we've learned, they want something in their hands that they can go away from that training with and start using immediately. So they'll be given a 30-lesson binder that has already been, of lessons that have already been identified and that work very well with our kids. And on top of that, we will be buying for each of the 8 schools, the full printed version of the SPARK curriculum for them to have permanently in their libraries. This doesn't have a time. The online access that the teachers get have a 3-year, it's only good for 3 years, but it's the cheapest way legally to put this curriculum in the teachers' hands. So they'll all be getting that. In addition to this, SPARK comes with a set of curriculum. Much of the stuff can be made quite easily out of simple things. Instead of having cones, you can take large water bottles and fill them with rice. There's a lot of ways, and GCC's been very innovative in developing modifications of equipment, but we will buy for each school the full equipment set, which should equip all 20 teachers with what they need to be able to implement SPARK on a daily basis. And then we also feel that teachers are motivated by what their principals want. Principals are motivated by what the administration wants. They all have to follow curriculum and have to be under DOE curriculum. One of the things we've learned in UOG is if you want a program to be sustainable with DOE, it has to be built into DOE. So what we're trying to do is we're also going to, on a 1-year basis, put a program coordinator for all of these efforts, both the nurses, the SPARK, and what we'll be doing with Special Olympics and what we'll be doing in the mini grants, they're in DOE who will be working directly with all the teachers and administrators involved and conducting quarterly trainings to continue to build the capacity, to continue to mine the SPARK curriculum and localize it so that when this project's over, we hope we'll have a Guam curriculum that we can carry through the whole year based on the SPARK, but adapt it using local resources. Briefly, the 8 school nurses, what we're going to do for them is we're going to provide them with high-quality uniform body composition scales, CDC recommended SNAP software, and DOE Central with a server to support so that as schools come online, they can be plugged into it. This should increase the overall capacity of them to accurately monitor our children's body weight. And then in the mini grants, a key thing is the superintendent was very concerned about sustainability, so no mini grant would be awarded. There'll be a committee formed between DOE and the NCD members that will put out the announcements, and it can go to teachers, it can go to outside groups, but the idea is to bring out new innovative ideas where we can incorporate physical activity and health in both the after-school programs and in the school curriculums. And it will not, no grant will be awarded if it's not sustainable in 2 ways. It trains and builds the capacity of the teachers. Doesn't just come in and do it, but teaches the teachers to do it. And second, it comes in and it provides them with the curriculum so they have it ready to go. They just take it out and it once again becomes part of DOE's curriculum materials. And then Finally, in all of this, we've set aside $20,000 from this money. DOE special ed teachers and volunteers are key to the Special Olympics effort. And so what we've done is set aside $20,000 to where the special ed teachers and representatives from them and representatives from the Special Olympics, we hope to meet with them and plan how can this best be used to assist the Special Olympics program, particularly as how can DOE help the Special Olympics program.
First, I wanted to thank everybody for the presentations that were made and a number of the statistics that were made. But the one thing that I think the community really needs to know is how much this is costing us. And when you talk about the obesity one, I know Jim left, but 2 years ago he gave me the statistics for how much Public Health and Social Services paid for the 3 M's, Medicaid, Medicare, and MIP. And he told me that 2 years ago, Public Health paid reimbursements to GMH for all the medical services GMH provides for the 3 M's, $28 million. In that same year, Public Health paid $31 million to renal care centers on this island. If that stat doesn't get everybody to understand the importance of addressing these, that doesn't even account how much we spent for cancer, but just on renal care, it was greater than the entire medical 3M spend.
Thank you very much, Mr. Vice Speaker. Anyone else have any questions? Speaker 1, Pat, Senator Elgin.
Thank you very much, and I appreciate all of the information that you've given me. I took notes, of course, because I want a condensed version of what you have here. But the PANDA group is that you guys are concerned about policy and you're being advocates. I think you guys need to go back to the Department of Education board about board policies, because I have seen board policies change from what it is that you're wanting and advocating that we used to do many years ago, and I know I'm going to give my age away. But it used to be where all of our elementary teachers taught PE. And then later on, of course, it stopped because then there were different curriculums that were implemented in the school system. Middle schools, the 6th graders and 7th graders and 8th graders all took PE, and then they changed them and substituted some of those classes. High school students were required to also take 2 years of PE. Now we're down to 1. I mean, there are a lot of changes at the policy level at DOE, and that's where you're going to need to start, and we're going to be very supportive, of course, of that. This concerns me. I've been participating in PHOA's meeting also, and they've just invited me to come to speak in Palau about this because of some of the policies that the legislature has been very supportive of. I like to work with you because some of the things that you're saying, Mr. Barber, that really wouldn't even take a lot of money in terms of how you can get credits for our teachers, and I'll share that with you, and it's board policy as well, and sometimes just getting, especially if it's going to be a pilot program, because I've done that before as well in my school, so I really want to work with you on this, but I support everything you're doing. So I mean, I don't want to say anything else other than to just try to meet with some of you individually to share some of my ideas and support also. Thank you.
Thank you very much, Speaker. Senator Elgin. Great. Thank you all again for all the presentations you've done. There was one group, I believe, did you have a communications group? Okay. To get it out there. Can we just go on the mic so that we can...
Done a good job. The commercials that you have seen is a product of the efforts of the communication team.
Great. Okay, thank you. I just want to share with you...
Can I...
Yes.
Mr. Breastfeeding. I'm sorry, no, it's funny you should say that because I'm going to remember you for that all the time. But, the law, yes, that was passed, 32-098, is that there are supposed to be rules and regulations that are supposed to be implemented, and they have not, and is anyone following up on this too? So maybe somebody can do that. Okay, thank you.
Thank you, Speaker. Yes, ma'am. Can we just get the mic and you can introduce yourself, please?
Yeah.
the Guam Breastfeeding Coalition actually is going down the road of introducing the public law to the hotel and restaurant. And what we would like to do is to do a recognition program for them, because companies, they like to be recognized. I'm sorry, my glasses. Yeah, they like to be recognized for, recognizing or following, be compliant with the law. So maybe we could ask the legislature to do us a recognition thing for them. I'm sorry, I'm Adelina Portela, Breastfeeding Coordinator, Public Health.
Thank you very much. I want to share with you, I was at the hospital 2 days ago visiting a family member, and, before I got up to the ICU, it took me about 30, 45 minutes to get up there, because at first I talked to a nurse that told me, she said, Senator, it's we're full at the hospital. And a lot of what's happening here is we're seeing a lot of people coming in with renal problems. And so, just like the Vice Speaker said, we're spending a lot, on that. And we know that the efforts of the group, is really to get our community to start, because once you're in that situation, it's late. It's in the late stages, right? And so we really, got to be able to get it out earlier, get the message out. And so that's why I asked for the communication. I know that, you guys are doing real great in putting these things together and trying to get it out there. But, I would really support and encourage that maybe we can take it to the next level, right? In terms of getting the message out there, getting it out there to the community. Like we tried this, we're doing this here today because we want to be able to get the new term, the new senators to be able to know what the group is doing. But I think really it's something, it's education. And part of what I don't know how it fits into the NCD, but we're seeing at the hospital, the emergency room is always where the bottleneck is at, right? A lot of people come in there when they're already in their it's worse cases already, right? And so that's why we have an urgent care there. It's been open now for a few weeks, but really I think the bottom line is trying to get our people into primary care. Trying to get them into this their annual physical examinations, and so I don't know how it's incorporated into the NCD, but that's something that really. And then after that nurse, I spoke to a doctor who was there, and he gave me an earful as well, and he's saying like people coming in here that never went to to a primary care, and so they're here when their situation is really much worse. So it's about educating them that, there's public health, and I know that they've, the community health centers has extended their hours, but really it's just trying to get them into, and Chuck, Chuck is an advocate for that. I know he's working on trying to network all the primary care clinics together. But that's something I think also, should be, and I would suggest if we can incorporate that into the NCD.
Definitely, it will be incorporated. In fact, once the money is released, we will have matching funds from our programs and do more health promotion activities. The project that Ken discussed is also addressing the Medicaid, but we will extend it to all the community. So, yes, sir, definitely, we will do more health prevention messages out there.
Thank you very much. Again, we have soup and sandwiches, okay, so don't be hungry, please. So get some, because I want to just ask, I don't mean to put you on a spot, and if you're not ready, it's okay, but Guam Cancer Care, maybe a few months ago, spoke to me about a program that they're doing, the kids strides. Was it the strides for the cure? Kids for the cure. And so, is that something that maybe just a few minutes can explain to all of us here? Because I think it's an awesome program, and I don't know how it's incorporated with the physical activity that the $300,000 was allocated for DOE, and maybe how we can be integrated. Yeah.
Possibly collaborate it. My name is Charlie Laron. I'm program coordinator for Guam Cancer Care. The Kids for the Cure program started about 4 years ago from Donna and Jude Baker with the Strides Foundation. In 2013, the Strides Foundation actually gave the program as well as the run to Guam Cancer Care, so we've taken it over for about a year now. What it is, it's a program it's a curriculum that teaches kids about cancer, what are cells, how to lead a healthy life, and the curriculum comes from the St. Jude's Research Hospital. And what we did is we also implemented a fitness component to it. So we work with custom fitness, and they come into the schools and teach the kids simple things. It's amazing how many of these kids don't even know how to jump rope, and these athletic directors come in and they're coaches and they become role models for these children. So in 2014, last year's school year, we were in 8 schools. We reached 1,200 kids, 3rd, 4th, and 5th grade, with a curriculum, followed with the fitness education. Right now we're in the schools as well. We were in 3 schools, hit, again, 1,200 students. We are currently in 2 schools, and we're going to be in another 2 schools. This is our way. The Strides Foundation, Guam Cancer Care, the funding all goes to fund this Kids for the Cure program. So it's a dual, and it helps with both education as well as getting the kids physically active. So it's proven to be very successful.
Is that similar to what the Sparks?
Sparks is a little different, but this would fit perfectly within the whole mini grant area where we're actually looking for other curriculum. Sparks is not the only curriculum.
Sure.
CrossFit has a lot of functional things that you can do with almost no resources. So this is exactly the kind of thing.
Great. Okay, so if we can have that, just get together and see how we can work better, because I know the data that was provided to me a few months ago was really impressive, and when the work that the Guam Cancer Care is doing with its Kids for the Cure, and that's really one of the inspirations for me to expand the use of the Guam Cancer Trust Funds is for outreach and education, and because when I saw what this was doing and how more can be done, and the plans that you guys have, I think will be very effective.
See, the goal eventually is after this pilot to start bringing these things together so that we don't have to go this far and buy for all thousands of teachers. The goal is eventually to bring all these different programs together and develop a curriculum for DOE at elementary and then later middle and high, and do it in a thing where both the after-school programs like Aspire, but as well as teachers can use as a pre-class activity. So these type of things, as we bring them together and get more and more, this is what the physical activity group wants to do in collaboration with DOE.
Thank you very much, Charlie. Thank you. Sorry, I didn't mean to put you on the spot. Thank you. Yes, Long. Can we use the mic, please?
If I might just add, BASIS and the functional fitness after-school programs were actually inspired by the Kids for the Cure. It's been the relationship is really symbiotic and really dynamic, and so that's and then of course getting that program coordinator in using the 300,000 will help coordinate all these efforts together and make it really more meaningful for the children later on.
Might I add just one thing? Right now we're doing this for 1 year. We ask that you watch closely on the 2016-2017 budget and make sure there needs to be a line item. We're doing it on a pilot basis, but it has to, for this to be sustainable, that coordinator's position needs to become embedded in DOE's overall curriculum structure. And so we ask that in future years, watch the budget.
Yeah. And that is why, sir, we also really funded the BMI health screening. That will be your indicator if the programs are working or not.
Great, thank you. And so that did come up during the discussion of this 700 and the 300,000, because we know it's a one-time funding source for now. But of course, moving forward, we're going to ensure that efforts like this are sustained. And so just as you said, the 16 and 17 moving forward is something we have to watch very closely. Okay, thank you very much. Anyone else? Yes, sir, please. If we can we just pass the mic? If you don't, no, we just want to be able to record it.
I just want to say from experience, as far as my 3 grandchildren are concerned, going to PC Lujan, and my 2 aunties, former teachers at DOE, in regards to the budget and what cancer, physical activities, what Bob Barber is doing, comments from the principal and vice principal at PC Lujan, and as far as was it Mr. Fernandez, DOE superintendent, the budget they request and whether or not he's not getting it, it has to work together with what Bob Barber's doing and the cancer physical activities, because the enrollment goes up every year at PC Lujan and all the other schools. You cannot give them the same budget every year. That's why they don't have enough textbooks. That's why he says, watch the budget. If you have an increase in enrollment every year, they have to get an increase in the budget every year.
Thank you very much, sir. Ms. Sabala, if there's no other questions or comments, we'll close it.
Sir, but we, from here on, we really look up on our champions. The four of you stayed for 1 hour and a half listening to us. That means a lot. That really means a lot to us. Guam is our home. We are committed to make it healthy, but we cannot do it without your help. So with all the members who are here, we'd like to thank you for your time. God bless you.
Okay, thank you very much. And please, as you leave, we have soup and sandwich again, okay? Thank you. You can balutin it.